You know what I'm saying? Okay, so this would be the gastrosplenic. It's going to the spleen, okay? And this is, of course, the superior mesenteric, but you kind of don't see it, but that's what it is, okay? Because this comes from it, and then it proceeds to the liver, you know, as the hepatic portal. So, but if we have better pictures coming, so I just want you to see what each picture is about, okay? So this is beginning to kind of show that a little bit more, and you can actually see from this branch here, which is the anterior pancreatico-duodenal vein, which is not on the list, okay, I know about that. But from that, you get the hepatic portal vein going to the liver. And then, of course, you get the superior mesenteric vein.
Where?
Right here. This big fat one right here. And then, of course, inferior mesenteric vein. I have better pictures. I'm just going to go through every pic, you know what I'm saying? So you kind of see everything, and, you know, and of course, the renal vein, of course, and the inferior vena cava. This is the ureter. It's kind of tainted a little bit with one of these blood vessels in the area. All right? And this is the remnants of the iliolumbar artery and vein. There's some parts where it shows it nicely. You see, it was cut over here, but it continues over here, and the vein is kind of hidden a little bit. Okay? Because this is down at the bottom where you have the common iliac vein and, of course, the external iliac artery. All right? You can see that at least. And I won't go into the other one. And this is the inferior mesenteric artery. See what I'm saying? This one here, the one that's kind of squiggly like that. All right? But there's another better picture that shows it nicely. Okay? And then this is probably going to the adrenal gland. Okay? But there's another better picture again for that. All right? This may be remnants of the internal spermatic, because this was a boy, I think. Internal spermatic or ovarian, I mean, if you say like that. The remnants of that vein, and this is the internal spermatic. And there's pictures that shows it better too, and you can actually see it entering the spermatic cord. Okay. All right. So this is more or less the same, really. This is again, you see, this entering the spermatic cord over here. You see that? The internal spermatic artery, and then you can see this is the vas deferens. Okay, the blood is over here. This is kind of not clear, but then I've got better pictures again. Again, this is the inferior mesenteric artery. Of course, renal vein, right? This is the gastrosplenic, and this kind of goes to the thing. The superior mesenteric, but it's kind of cut off a little bit. Again, better pictures coming up. This is beginning to show a little bit more what's going on down here. And of course, this is on the lower part, so this is the inferior mesenteric artery again, and spermatic and so forth, and of course external iliac. I have better pictures. I'm just going through each one, and like this one is the best, right? You see what I'm saying? So again, we've got a lot going on here. We get the what's that? The hepatic portal vein, superior mesenteric vein, and then
where's the superior?
Right here. This big fat one right here. Okay. And then this is the gastrosplenic. You don't see the spleen, but it's going there. Gastrosplenic, okay? This one right here. And this is the superior mesenteric artery. Alright? This is the celiac artery, or you can call it celiac trunk if you will. And then this is the hepatic artery. And this is the gastric, is kind of in the middle here. And there's some parts it shows it nicely. And then this is the splenic artery. Okay, because it kind of splits into the three like so. Okay, the celiac trunk. And of course, this is that internal spermatic artery. And I think when they did this incision and they sutured it up with those thick, you know, string and stuff, they pulverized our, you know, we'll kind of look for it on the other side, the internal spermatic vein. But anyway, if you have vena cava, and you get the renal vein over here, and then you get the adrenal lumbar vein going to the adrenal gland over here, all right? artery over here. The ureter, and then of course, this is the aorta, of course, going down. And then you see it right here, the iliac lumbar, you can see this, it got cut off. The vein didn't get infused with that blue latex stuff, so that's why the vein is kind of like not really showing. But on the actual cat, we could see it, you know, when we go to the actual cat. But this is, it's kind of somewhere here, this is the iliac lumbar artery that you can see, and of course external iliac artery and common iliac vein. But there's a better picture where it shows this down a little bit more, okay, later on. But we kind of got most of those, and of course this is the inferior mesenteric vein, okay, and superior mesenteric vein gastrospleen, and then of course the hepatic port. All right. Again, kind of like the same picture. This time I flipped it the other way, so you could actually see the gastrosplenic going towards the spleen, all right, coming from this superior mesenteric, inferior mesenteric, and then of course the inferior mesenteric artery. This is the inferior mesenteric vein, superior mesenteric vein, gastrosplenic, superior mesenteric artery, all right, renal vein, inferior vena cava, internal phlegmatic. Now you can actually see it going down into there. All right. And then I'm going to have, so this is the top. You see this vein here that is kind of sort of shown by this probe, which is the ascicus vein. Right. And then of course this is the superior vena cava. Superior vena cava, right? Coming out of the heart.
Oh,
and,
yeah.
And then this is the internal mammary vein. See that side, that side. You can see it on there. The costocervical is kind of supposed to start up here. It's going towards the neck, towards the ribs over in the neck area, towards the neck. So it's costal cervical, costal ribs, cervical neck. Okay, it's kind of hidden. I think it will be part of this a little bit. We can search more when we open it up. All right, and on this side you get the brachiocephalic artery over here, right? And then you get the common carotid artery, right? Common carotid artery. So from this common carotid artery here, you get the subclavian that comes up, and this stump here is probably the internal mammary artery, okay? Because it kind of splits on this. And I want you to use the diagrams I gave you. They got pictures of from top to bottom of the cat, right? Veins and arteries, okay? And it's one of the diagrams, one of the handouts I gave you. And also use your, I wrote it in the email as well. This is a very good, you know, the lab manual, okay? Use it for 300 and some page, and it will have diagrams of actual cat so that you can help to estimate the location of some veins, and then you can look for them in your actual cat and so forth, especially as we go towards the final. You see, it's got these, and it also has the human and then the cat together, you know what I'm saying? So you can kind of sort of see the context in which we are using the cat, you know what I mean? So I really urge you to use the lab manual, okay? And it's got good cat diagrams and cat pictures, starting from this page, from page 387, all right? If you go there, it is some of the other ones like the thoracocervical and the costocervical arteries and veins and so forth. It shows you the approximate location of them, so you can actually look for them. You see how it is, all these diagrams. Okay, some of those other ones. And of course, the diagrams I gave you, they have all those blood vessels, they're all labeled up. So please use that. Okay. And so here it's kind of a bit crammed, okay? But we have from the superior vena cava right here, And we got the internal mammary veins over here, coming out on both sides. This is the brachiocephalic vein, the first split, okay? The brachiocephalic vein kind of splits into this, which is the subclavian. So an arrow pointing to this will be the subclavian, all right? This is the subclavian from pretty much here to this split here, which becomes the axillary vein, and this becomes the subscapular vein, all right? And then this is, of course, the axillary artery, okay, going down that way, and then of course this is the axillary artery going here. Once it reaches here, which is like the armpit, if you will, or leg pit, it becomes the brachial vein and brachial arteries, okay? But it starts off from the subclavian as the axillary because it's going towards the armpit, all right? And then, of course, the subscapular is the branch that goes into the subscapularis, the muscle behind the scapula, right? Over here, okay? And then, of course, this branch going up here is the external jugular vein, all right? And then the external jugular vein has this branch over here, the transverse scapula, right? Transverse scapular vein, all right? And also here, you probably have another picture that kind of shows this going up here as well. Is this may be part of the thyrocervical vein, which also has an artery coming up here. You see this kind of reddish hint over here? We'll kind of look for it when we go to the actual cat, okay? But there's some pictures that kind of shows it nicely. It's thyrocervical, it's kind of going towards the neck up here, and it branches from somewhere on the subclavian here. You see, this is the subclavian, this is the brachiocephalic, and this external jugular vein. This and that, especially on the side, it's nice and prominent. Internal jugular vein, you see that? The internal jugular vein that's running alongside the common carotid artery, all right? Okay? And then once you get up here, you have the transverse jugular vein over here, and it joins the external jugular veins, okay? So, azygous vein, superior vena cava, and of course internal mammary, and this is most likely the stuff of the internal mammary artery right here, because it's splitting here to the subclavian artery, and which also splits into this, which runs along. You see this running behind it would be the subclavian artery on this side, which is I think the right side, and that's the left side, because the subclavian artery on this side runs by itself, and it starts at the aortic arc, all right? The subclavian on this side is a branch of the common carotid, right? On the right side, all right? So we've got quite a number of them, and I've got pictures, more pictures on this view, so you can see, like this one kind of shows it, and then you can see, of course, this is the left subclavian artery, all right? And something heading up over here would be, you see the stumps of the internal mammary on this side. Do you see it right here? Do you see the cut? And also this on that cut, because it's a branch coming out of the subclavian arteries. Okay? The subclavian artery is kind of hidden here underneath this subclavian vein. Okay? And that's the first. And you could see this, you know, like the internal mammary, and of course the vein and arteries. You can see them nicely on these diagrams in that one that I gave you. I think the one with the list, I think. Yeah, anyway. But you look at those handouts for some of the other ones that are not very obvious on the CAT, because I still kind of need you to know the approximate location of those blood vessels, okay? All right, so very good. And I've got many of these, again, showing the same kind of, you know, view. And this kind of focused on the other side, but this doesn't show nicely the subscapular artery and vein and so forth, okay? So I'll skip that. And some of these other views that are a little confusing, I'm not going to include them, but you can see on the side it shows nicely, you know, how both the subscapular artery and vein can split over here, continues with the axillary, and then from then on, inside comes brachial vein, all right? And then up here, of course, nice transverse scapula, all right? And that's another one again. This part of the vein, internal mammary vein, didn't get infused nicely, but this one did. So this one kind of looking like off blue, but it is a vein. Alright, so we'll skip through that. This is attempting to show the caudal arteries and veins. Of course, this is that stump of the iliolumbar artery and vein that we cut up. And you can see the vein part of it. Do you see this colorless sort of thing going out of here? Mm-hmm. The one I was saying that it's not really well perfused with that, you know, latex, blue latex, right? Okay, so that's iliolumbar artery and vein right here. Artery, vein, okay? Inferior vena cava and descending aorta, abdominal aorta, right here. And then of course the internal iliac artery splits it to the left and right. You see that? It comes down, splits into the left and right, and it continues with the caudal artery going to the tail, right? Then of course this is the external iliac artery, right? And there's another picture that shows the internal iliac vein nicely. You see, that's why I put this little probe over there so you can see that. See the internal iliac vein. So this is the common iliac vein, and then after the split of the you know, internal iliac vein, then you get the external iliac vein. And here it's kind of hidden. This is where you kind of get the split. I'm going to have to clean it up and maybe take another picture. You know, but for our purposes right now, we're using these pictures. You get the split into the deep femoral artery and vein, the one supplying the deeper muscles of the artery, of the thigh. Correct. All right, and then it proceeds as the you know, femoral artery and vein. You see this femoral artery and vein. This split here is the proximal caudofemoral artery and vein. Proximal caudofemoral artery and vein. I don't know if that's on the list. All right. Continues as femoral, and this one continues as the popliteal artery and vein going towards the knee, and this is the saphenous artery and vein. All right. Kind of splits up into the tibial and veins and arteries. Okay. Supplying the rear and the front part of the leg. All right. That's pretty much it for that. And then I have other repeat views. This one kind of trying to show, of course, the internal iliac vein over here. And I'm going to clean this up so you could see. See this one right here inside here. You see this little red and stuff? That's where you get the split for the, you know, the deep femoral artery and vein. So I'm going to kind of clean that up a little so we could see that properly. And then I'll include those pictures, especially in the final. All right. See another picture. This time I put my flash on just to see if I could bring it up nicely. But you could see now very clearly the internal iliac vein. Did you see that? Mm-hmm. Because I put my little flash and it went bam. Yeah. And you could see this is the internal iliac, internal spermatic, and then goes into the spermatic organ. The remnants of the testes and stuff. Covered by this is the gracilis. Oh, yeah, it's the gracilis, and up here is the sartorius. Right? See, I had to fold it back so you can see that, and then put that in there. But in there, somewhere in there with this little red, that's where the deep femoral artery vein is. Yeah. And then of course, which one is this though? Can anybody tell me which one this is? Which blood vessel this is? We kind of went over it a few times. Several times.
Memory?
Oh my God, we are down here by the caudal veins. You remember this is the leg, So we're down here, and this is the inferior what? Mesenteric artery. Yes. Do you see that? And this is the stump of the iliolumbar. You see this artery, and then the iliolumbar vein is kind of here. But that one is not perfused, so that's why it didn't come out nicely. Okay, and then the renal over here. So we're going towards the head over here. All right. Okay. Anyway. All right. So they, I think I really wanted to show my internal. That's why I took many pictures of this. I have to clean it up to show my deep femoral artery and vein, though. All right. And then this one, you see, it shows nicely the celiac. Okay. And this is the superior mesenteric artery. It's kind of showing it on another view, like that. But this is the hepatic, you know, the gastric and the splenic arteries. So this is the celiac artery or celiac trunk, if you will. All right. That's that. And then what is this? Which one is this? What's this? Huh? Anybody want to tell me what that is? Yeah, spit it out. You're correct. Adrenal lumbar. Adrenal lumbar. It goes to the adrenal gland, right? I didn't want to ask this one because obviously you all say adrenal gland, right? You can see the kidney right here. But this one is one that goes to the adrenal gland right on top. Okay? Adrenal lumbar. Because it goes to the adrenal gland. You see the kidney, adrenal gland. Kidney, adrenal gland. So renal vein, adrenal lumbar. So when you are identifying these blood vessels, like I said, always look what's surrounding, all the organs surrounding it. You know what I'm saying? Did I go? Did I proceed? Oh, what? Yeah, always look at the surrounding organs because they help you out with the name of it. Okay? So you need to know and you know, you don't have to see the whole cat, but if you know, you know you're in the lower abdominal, if you start seeing this, then you start seeing the split of the aorta and the inferior cava, you know. Again, more of those, you know, showing nicely this celiac and so forth, all right? And then again, you know, showing them nicely here, the hepatic, gastric, and splenic, and of course celiac trunk. And it shows nicely our renal and our adrenal. Right. Again, I took another picture. See, this is the you see the red behind this? Mm-hmm. That's the thyrocervical artery. Okay, because it comes out of this branch of the. You see, this is the left subclavian, right? You see, left subclavian, and this is the left common carotid. The left subclavian continues up towards the neck as the thyrocervical. All right. And you see right here, you see that? A split from the common carotid on the right side gives the subclavian artery on the right side. Do you see that? And then this is the one I was calling the internal mammary, going to the breast tissue. It splits out of this subclavian artery. Right? And then the subclavian artery continues up here and then splits into, you know, and this is, you see the split going up here that's kind of cut over here, that's the thyrocervical on the right side. You see it? You see here there's a little split right here. Do you see it? Mm-hmm. Or is it just me?
No, what is it?
Yeah, very good. So that's going up towards the neck area, thyrocervical artery. But you could see the remnants of it on this side. It's kind of hidden by this external jugular. Okay? And then you can see the internal mammary here too. Alright? And this time I didn't put my little pin or my little probe for that azygos vein because it comes right out. As soon as the superior vena cava exits the heart, then boom, that azygos comes out. Okay, and then of course, brachial artery and vein, of course axillary, subscapular artery and vein, and so forth. So repetitive. Again, we saw this, and then I'll put this up there, and that's it. So we got